Hey D&D fam. I'm Quick.
And I'm Lee, and you're listening to
Divas and Ducats. So what is a diva? I think divas get a bad rep. But to me, diva is all about the attitude.
As for ducats, it's your finances, your assets, Skrilla, guap, your coin. We're talking all things with the potential to affect your pockets.
And while we're attorneys by trade, we are divas by choice. Divas and Ducats is for edutainment purposes.
Y'all, we are not Series 511 or 703 professionals. This does not create a financial advisor or attorney-client relationship. The views expressed here are solely our opinions and the opinions of our guests.
It's just our opinions, y'all. Okay, divas, let's talk ducats.
All right. Hey, D&D fam. How y'all doing?
Welcome back.
All right. We are excited today. We are getting into some of the insurance coverage things we wanted to talk about. That season comes around and we'll be getting into even coverage at a certain point with employers. Yeah. But today we are going to be tackling Medicare, and we brought in a guest, Miss Melinda Butler. Welcome.
Thank you, ladies. Happy to be here.
So before we get into that, we want to make sure that if you are watching, you click subscribe below.
Hit that button.
We appreciate you being here with us, and we're going to hear a word about our sponsor.
Yes, this episode is sponsored by Wooden Bowers. Accidents happen everywhere. If you have been injured on the job, in a motor vehicle accident, or even on someone else's property, you can contact the experienced attorneys at Wooden Bowers for all of your personal injury needs. Their phone number is 704-665-5838, and their website is wbvlaw.com. We have had one of the attorneys on last year.
2020, like before we were on YouTube.
Yes, we got to think about the years.
I know.
Yes, he was on in 2020, so you can catch that episode. It was really, really good. He was talking about different estate, right?
Wills, around November 2020. Yep.
That was a really, really good episode. So if you have any of those issues, they are wonderful attorneys here in the Charlotte, North Carolina area. You can reach out. You can also go to our website, subscribe to our newsletter, and when the episodes come out, you will get notified when the episode is, what episode is, and their sponsorship will actually be in that newsletter. So you can just click it, not have to remember any of the information, and it will go directly to their episode and to their website, and their information will also be in the show notes of this episode. So just make sure that you click below if you are in need of an attorney that services those areas.
All right, convenience. So let's get into it. We have Melinda Butler here today to talk to us about Medicare. And so we're going to just let you introduce yourself. Like, who's Melinda? What does she do?
Okay. So, yes, there's another Melinda out there.
Right.
My name is Melinda Butler. I am, by profession or by career, I'm an occupational therapist. I have a doctorate degree in occupational therapy from Creighton University, which is a private school in Omaha, Nebraska. Okay. I've been practicing as an occupational therapist for 18 years now, starting when I was 10. So, and I love what I do. I'm actually a director of rehabilitation at an inpatient rehab facility located here in Charlotte, or actually in Matthews. And I really, in helping my patients and the family members, I just started to learn and do a lot of research. So really this kind of SME or subject matter expert status that I've acquired in Medicare developed really organically just by me trying to help my patients. So
so they would be injured, and then they would have Medicare. And you would have to help them with the various questions that they were.
Absolutely. So when our patients come to us, they usually come to us straight from the hospital where they have had a medical condition, illness, fall, or surgical procedure. We get a lot of joint replacements and things like that. And most of our patients are Medicare recipients, so that kind of 65 and over age range. People younger than that can have Medicare in certain circumstances. We'll talk about that later. But the majority of our patients, I'd say 90%, are Medicare age. So that would mean 65 or over. And when they come to us, that's kind of that midway point between you're stable enough to leave the hospital, but you're not quite ready to go home.
Right.
You need some physical rehabilitation, some strengthening, and some nursing care. And so they come to us for that in between. But the challenge is that depending on what type of insurance coverage they have, the insurance benefit may run out before they're ready to go home. And so then we face these problems and challenges with what comes next. So
So you had to learn about it. Well, you chose to learn about it, right?
absolutely.
Yeah.
Could have left them high and dry, but I just wanted to help.
Absolutely. And that's important, you know, to have that, because like you said, that also was an option.
Right.
But in acquiring that information, and the more that you learn about Medicare, like, tell us the interesting story of how people put it on you to be the SME.
Right. So what would kind of happen is, because I'm the manager, that I'm kind of the face of the department and the representative of the department. And so when they would learn that their insurance coverage or their benefits were coming to an end, they'd come to me panicking and saying, hey, why are you all releasing my mom? Or my dad, you know.
Yeah.
They're not able to walk on their own yet. They're not at their prior functional status. And so and they live alone, these types of things. And most of our older adults want to age in place. And so they don't want to go into assisted living or nursing home. And they are dependent on us to help them get where they need to be. And so if the coverage runs out before they get there, or if it's clear that they're not going to get there, because let's face it, sometimes the medical conditions are too pressing and they're just not going to regain that status. So I would help them navigate that process. Myself, along with our social worker, we work really well together, and we try to help them navigate to figure out what comes next after those services end. So I just started doing research about different types of plans. A lot of times they would ask me about their coverage, and they'd say, well, my mom has Medicare Part A and B and all these alphabets, A, B, and D, and everything.
Yes.
And so they would say, so I don't understand why someone is saying that their benefits are coming to an end. And what we would find in most of these cases is that they had a Medicare Advantage plan. And we'll kind of talk about that a little bit later. So I started diving into these different types of plans so that I could explain to them what their benefits were, and then talk to them about what they can do, you know, moving forward to make sure their loved one had the care that they needed.
Got you.
And this knowledge ended up in you doing something really interesting with Tom Joyner.
Yes. So I had an opportunity. A friend of mine invited me to go on the Tom Joyner Fantastic Voyage cruise. This was kind of a last minute kind of cabin release where maybe someone backed out. So they were releasing this cabin at a very reduced cost. So I paid for it and went on the trip and enjoyed it. And then at the end of the trip, you know, I said, oh my gosh, I had so much fun. I would love to go again, but it's so expensive. And I happened to run into someone that I knew, actually a member of our chapter, and I said, what are you doing on this cruise? You're kind of young, because the average age range is about 40 and up for that trip. And she told me, oh, I facilitated a workshop. And I was like, what? And I kind of saw in the program each day that there were some workshops, and I didn't really attend any. I was more into the day parties and the other types of activities going on. But she told me that a lot of people attend this trip, and one of the highlights for them is these workshops where they can learn about finances and relationships and all of the topics you all have on your podcast are some of the various topics that that people would introduce and present on that cruise. So I was like, wow, I could present something. And then my friend who I was with said, well, aren't you always teaching people about Medicare? You should submit a proposal and teach about that. And I was like, great idea. So I submitted 2 proposals, one on Medicare, one on dementia. So if you'd like to make that a topic at some point, let me know.
Yes. Yes. Near and dear to my heart.
Yes. And so they chose me to do both of those. So the first year I did that was 2018. I submitted again in 2019, got selected, and then again in 2020, which that cruise, of course, was reschedule, postpone due to the pandemic,
Yeah.
and moved to 2021, and I facilitated again. And I added another workshop this time too, called Parenting Your Parent. And I believe you've had that topic here.
The
Yes,
caregivers,
yes.
Yeah.
So that also another necessary topic, and I've just enjoyed it, and in doing that, I did even more research. And
Right.
every year I update my workshop to reflect some of the changes and the rates and things like that. So that's how it happened. A party with a purpose.
Yeah.
Right. So what are some of the biggest, because you use like it's the alphabet insurance, right?
Right,
So what are
right.
some of the differences between the letters?
Right.
I don't even know how far the letters go down.
Right,
That's why I
right.
didn't even
A
start.
through
Right.
C? I thought it was A through
There
C.
is a D now as well.
Oh, okay.
Since 2006, I believe, there was Part D. So let's start with Medicare Part A.
Okay.
That is your hospital coverage. And so unlike a private insurance or an HMO or PPO that we would get from our employer, with Medicare, you have these different components. And so Part A is the hospital coverage. So if someone went to the hospital, maybe to the ER, and then they were admitted, they would bill those services to their Medicare Part A
Okay.
plan. And then Part B is just like your regular health insurance. So no different than you take that insurance card, you go to the doctor for well visits or a sick visit, or different procedures, tests, MRIs, mammograms, different things like that. We would use our regular insurance. So that's what the Medicare Part B is. So if a person has a traditional Medicare plan, they would have Parts A and B. In most cases, there are people who don't qualify for one or the other, or they have to pay a larger amount. Typically, Part A is free. You don't pay for Part A, the hospital coverage.
Okay.
But if a person, you had to have worked 10 years in this country to qualify for the free, so to speak, Part A benefit.
Okay.
If a person has not met that criteria, then they will pay based on how many years they did work in the country. So some people may be paying a portion for their Part A benefit, and that would be why.
Okay.
Part B is, like I said, the health insurance portion. That typically comes right out of their Social Security, and that is the regular medical insurance. There is a deductible that has to be met each year, just like with any other plan, and a lot of people don't know that. And then the other kind of myth about Medicare is people think that if they have Medicare, it covers everything, and it doesn't. Medicare is an 80% plan. So of all of the things it does cover, it's going to cover that at 80%. And so they would need a supplement, or Medigap, it's also called, which is that supplements Medicare. So it doesn't pay in lieu of Medicare, because a lot of people make that mistake too. Oh, Medicare won't cover that? Well, here, I have
My gap.
I have my Medigap. But it pays along with Medicare, and it fills in the gap, which is that portion, that 20% that Medicare does not pay.
Gotcha.
It does not pay in lieu of Medicare.
Okay.
So if Medicare doesn't cover it, then neither will the Medigap plan. And there are a lot of things that Medicare doesn't cover that comes at a surprise to people. They don't cover routine eye exams, hearing aids, podiatry services. Right. And so that often comes as a surprise to people. Now, there are some exceptions. For example, if someone is a high-risk patient, so maybe they have diabetes and macular degeneration, then their eye exam would be covered because they have this qualifying condition.
Right.
But for general purposes, they do not cover dental exams, hearing aids, eyewear, anything dealing with the five senses, so to speak. So,
Interesting.
yes.
And I just wouldn't guess that those things, you think of them as like, I guess, basics at that age, especially basic services.
Right.
They don't cover.
So take care of your feet, you all. Get those
those
petties. Yeah,
pedicures.
get those petties. Men too. Get your pedicures.
Yeah.
And we want to take care of our health, because the healthier we are, the less likely we are to need some of these services that occur when we have declining health due to diabetes and other health issues. So So then there's Medicare Part D. This is your prescription drug plan.
Okay.
This started in 2006.
Okay.
So anyone who enrolled in Medicare prior to that, their drug plan they're kind of grandfathered in. Their drug plan is included in their benefits. But if you enrolled in 2006 or after, then that drug plan is not covered, and you have to take out a separate plan for the prescription drugs.
Okay.
And a lot of people try to kind of skirt the system and say, well, I'm still healthy. I'm going to wait. You can't wait until you need it. You'll start getting lots of mailings and emails and all kinds of phone messages when a person becomes eligible to enroll in Medicare, and that would be 90 days prior to the 65th birthday.
Okay.
And you want to stay on that unless you're still employed and you receive benefits from your employer. That would be the only exception. But if you become eligible, you definitely want to enroll in those benefits at the time of eligibility. Like I said, unless you're still working.
Got you.
Is there a waiver
And
if you
insured.
don't, or because you're saying you want to stay on top of it? Is it a waiver if you don't once you're eligible?
Well, yes. So if a person still has insurance coverage through an employer, or they're just paying for their own coverage and they prefer to use that, that would be fine. They have to have a letter proving that. So if an employer would be able to provide them, like their HR rep would be able to provide them with that evidence.
Well, I guess you were saying like you don't want to wait until you need it. Like, is
Right.
it because it takes a long time to get
No.
it? Or,
Yes, good question. It's because there's a penalty.
Oh, okay.
And so when a person does not enroll at the point that they became eligible and they did not have other coverage for their Part A or B or the Part D prescription plan, then when they do enroll, there is a penalty. Sometimes 1%, it could be more, and they pay that penalty for the rest of their lives.
Dang.
Yes. Yeah. And so you're basically going to make up and pay what you didn't pay in the beginning.
You're going to get this coverage.
Right, right.
Okay, government.
Right.
So wait, what about the C?
Yes. So Medicare Part C, this is the complicated part. And a lot of people have Medicare Part C and they don't realize it. Medicare Part C is a Medicare replacement plan or Medicare Advantage plan.
Okay.
So you probably see these commercials on television. Humana, Blue Cross Blue Shield, Blue Medicare.
Yep.
Aetna has a Advantage plan. Cigna has an Advantage plan. So lots of different private insurers have contracted with Medicare to offer a Medicare-like policy. And they are similar, but there are some differences as well. Okay. These plans are typically lower in cost than traditional Medicare. And so for a lot of aging adults, that's very attractive.
Right.
They want to save a dime, or a lot of older adults are still paying mortgages.
Yeah.
According to my calculations, when I'm 65, I'll still be paying my student loans. So, and these are very real issues that people have. So those lower cost plans sound very attractive to many people for many reasons. And they will enroll in those plans, but they don't really always realize what they're getting. They think that a lot of times people think they're buying a supplement. So remember the Medigap we talked about?
Yeah.
So when they hear Humana, Cigna, oh, yes, I do want a supplement. And so they'll enroll in the Medicare Part C, which is also called Medicare Advantage. Having all the different names also makes it confusing. Right. Can we just get one name and stick with that?
Right.
So Medicare Part C, Medicare Advantage, managed care, those terms are all synonymous, and they all are used interchangeably and mean the exact same thing.
Okay.
And so these plans are, like I said, typically lower cost, but they are managed, and that's why they can offer them at lower rates, because they're managed by a case manager. So when a person comes into my setting, which is an inpatient rehabilitation setting, and they know, everybody kind of knows the basics. Medicare will cover at 100% for the first 20 days. And then from day 21 to 100, I'm going to have a copay unless I have a supplement.
Right.
So a lot of people with Part C think that's their supplement.
Right.
And then they come to the facility, and then the provider issues a notice of Medicare non-coverage. We call it a NOMNIC for short, notice of Medicare non-coverage. And they only by law have to give a 2-day notice. that the coverage is ending. And so that puts people in panic mode. That does
Right.
not allow a lot of time for planning.
Right.
And that's when people come to me desperate. Hey, the insurance is saying that you all said my mom is ready to go. And I say, no, we didn't say that. They're interpreting our documentation and applying it to the principles of their plan. And even though they, in theory, follow Medicare guidelines, they have a plan that Medicare has subscribed to, and Medicare has said, yes, we accept your plan. So there will be some nuances that are different from traditional Medicare. For example, with traditional Medicare, we would cover a patient if they lived alone. We'd try to cover them until they reached independence,
Right.
unless that wasn't a realistic goal.
Right.
But if we knew that was realistic, that would be our goal, that they would return to independence before they get home.
Right.
But with an Advantage plan, they would, if the patient gets to a level where maybe they just need someone just on standby or just in case, or maybe when they go to get up from the chair, they need that subtle nudge and help them get up from that chair. If once they get to that level, with a Medicare Advantage plan, they often end coverage and they say, well, the person can go to a lower level of care now, like an assisted living setting, or they can recruit friends and family to assist at home. And so a lot of times, even though there are supportive family members, they have jobs, they have families.
Right.
And so that all sounds good in theory, but realistically, that can be a challenge.
Right.
And so I end up explaining a lot of this to the families when we have our care plan meetings. Often I find myself spending 50% of that time educating them on their coverage because they are so confused by it. And so but I enjoy doing that, and this is not to knock the Advantage plans at all. Medicare had been abused, whether it was intentional or unintentional. But most people see Medicare as a right, kind of a rite of passage. I'm 65. I've worked hard all my life. I have a right to have this benefit. But it actually is not a right. It is an insurance plan that is only to be used when it's medically necessary, according to the Medicare guidelines. And so we have to educate ourselves that this is not a right. This is insurance coverage like anything else. It is not intended to take care of you as you age. So that is a big misconception.
It is huge, because I definitely thought
I was
that.
like, I mean,
course that's
I've
what's
been
for.
paying, so
Been paying into it your whole life.
Right, I was like,
yes,
right.
absolutely.
so that is a make sure y'all get some long-term coverage or something, because
And that is a good point you bring up. Long-term care insurance. It's very expensive, but it can be worth it. And if the younger you are when you start, the more affordable it will be.
Yep.
Long-term care insurance, if the person is a veteran, tapping into their VA benefits would also help with long-term care planning. But you definitely want to have a plan in place, because Medicare does not pay for routine care needs.
Right.
They call it custodial care. Custodial care. So let's say, Nana or Big Mama we were talking about is just getting now she's got diabetes and she's got some sensation issues, not able to really feel her legs and feet. There's maybe some circulation issues, and it's a little harder to get up, and it's harder to get around. And she just needs, and maybe it becomes a fall risk, and maybe she's fearful of falling. When you have decreased sensation and circulation issues and pain, people become more fearful of falling. And she might just need a caregiver just to assist her with a shower.
right.
Well, Medicare doesn't pay for that. That's considered custodial care. And so these are expenses that are out-of-pocket costs if a person doesn't have other coverage for them.
So I guess that's what they say. What a daycare and elder care is the most expensive.
Yes, absolutely.
So now it sounds like the Part C is optional. Does a person still have, I guess, A and B if they opt out of C, or do you have
Right.
to-
So
okay.
Yes. So a person can enroll in Medicare Part C in lieu of their traditional Medicare Part A and B and D, because usually the prescription drug plan is all rolled into that one plan with the Advantage plans.
Gotcha.
So it's kind of an all-in-one plan. So it sounds a lot more simplified, and that's also attractive, you know. And so if they enroll in that plan and decide, this isn't for me, I'm going to go back to traditional Medicare, they do have the right to do that. But there is a caveat. If a person had a supplement or a Medigap plan and they drop it to enroll in an Advantage plan, they may not be able to purchase another supplement. So they can go back to traditional Medicare, but they may not be able to buy another supplement.
Gotcha.
So it's almost like a penalty, so to speak.
Right.
Penalties.
Yes, yes.
So as far as like the application process, because I'm just thinking, 65 is not that old, but if you have health issues, I mean, my father has dementia. It started in his early 60s, so at 65 he couldn't have done this. So I'm thinking more so about those people, right?
Right.
So the application process, is it I already know because it's a government site. It's not, but.
Is it user friendly?
Yeah, is it user friendly? This is Medicaid and I want A, B, check mark, and it's one application, or do you apply for A, apply for B, apply for C?
Yeah, so I've never actually gone through that process because I wouldn't qualify to register an account.
Have it.
Yeah, and I've never sat down with someone as they go through.
Okay.
But I would think that for an older adult that maybe did not grow up using a computer, even if the site is user friendly, it can be very intimidating.
Challenge, yeah.
And this is a reason why a lot of people do enroll in the Advantage plans too, because they get a phone call and that person on the phone is saying, they'll do all the work for them. And so all they have to do is say yes, and then the person types everything in and it makes it easy. Yeah. And so, again, lots of benefits to Advantage plans. So definitely not knocking them. And for some people, they can't afford to have money coming out of their Social Security for Medicare for some of the reasons I named earlier. Mortgages, student loans, taking care of other family members who may have medical needs. So
elaborate on that, because that was my question. Like, how does Medicare and Social Security tie in together?
Because doesn't it look on? Sorry, I was just looking at. I don't know why I look at my pay stub and get mad about taxes. But then, I was like, I looked it up the other day. I was like, what is this? Like, what am I paying for?
Right.
And it's like OASDI, something like that. Yeah. So what is?
So Medicare is so let me start. Medicare is paid for through the Social Security Administration. Okay. And so that means taxpayers. We pay for Medicare. And so when you look at your stub, that FICA, and I can't remember what FICA stands for, but that is the Medicare.
Okay.
Yes. Now, and then the employer pays the other portion. And then for Medicaid, and we can talk about Medicaid a little bit if we have time to, but with Medicaid, and just the difference between the two, I'll just quickly say, because a lot of people think those are interchangeable as well. Medicare is a insurance plan implemented by the federal government. It started in 1965. That was when Lyndon B. Johnson was president, signed into act or by Congress the Social Security Administration Act. So when that occurred, that meant that when a person reaches the age of 65, they were able to enroll in the Medicare plan if they met certain criteria. And it's through the Social Security Administration Act, which is why the Medicare cost comes right out of the Social Security.
Right.
Medicaid is a state plan, so every state will be slightly different, but it is designed for people who live in poverty.
Okay.
For Medicare, it doesn't matter if you're a millionaire, a trillionaire, or a thousandaire.
Okay.
Right. Once you're 65, you qualify for Medicaid. Doesn't matter what your income is.
Gotcha.
But for Medicaid, that is for people who live below the poverty line, whatever that would be in any state. And it will vary state by state.
Gotcha. So when you often hear about people having to deplete their resources in order to, for elder care, they're talking about Medicaid, not
Absolutely,
Medicare.
Absolutely.
Okay.
And so when a person comes to a place like mine, we do the short-term rehabilitation. but we also offer long-term care. So for those who are not able to return home, they would stay for long-term care or nursing home care. And then they have to pay for that, right? Because Medicare doesn't pay for your housing. And when we, it usually clicks when people say, wait, but they have Medicare and a supplement, this should be covered. Well, it's your housing. Insurance doesn't pay for a place to live. So you have to have another means of doing that. And so the housing portion, or the room and board portion, if you will, would be paid out of private funds until the person depleted down to $2,000 in their account. And that's for North Carolina. If you're watching in other states, it might be a different amount. Once they deplete down to that amount, then they would qualify for Medicaid. And they can they can spend down, we call it a spend down. You can spend down on personal items, entertainment items. So a lot of people buy a TV, an iPad. So they can spend down on things for themselves. They can buy their burial plot, pay for their funeral up front. And so they can do those things. But if they have any investments, life insurance, any of that, they have to sell those things, cash those in, and apply that toward their care. And then once they reach down that $2,000 mark, then that's when they would qualify for Medicaid. And so their Social Security would go to that nursing home, and they get to keep $30 a month of that for personal use. Now, you might say, well, that's nothing.
So generous.
Yes. And this is the crazy thing. That amount has been the same since inception. Yes. And so there's no allocation for
inflation.
For inflation, exactly.
Like everything else.
Right. So it's kind of challenging.
For $30.
Right, exactly.
Totally.
But I guess the thought process is that all of their basic needs are being met, and so that's truly just spending money. But our older adults today, they want
like
the
to do
iPads
stuff.
and
They
want to go
to that Greg.
Yes, they're
FaceTime.
FaceTiming and everything.
That's
I mean,
crazy.
we had a patient, the therapist came to the gym and laughed. She said, my patient just refused because she was on a Zoom call with her family, So they're into this stuff now.
Yeah.
And we'll see that more and more as, we see older adults who are tech savvy and using some of these digital types of media to communicate.
So once a person they're 65, they qualify for Medicare, is ongoing. Are those, because I think you were saying in Part B, there's a deductible or that has to be, is that coming out of the Social Security still if they're receiving?
No.
Okay.
Yeah, that is going to come out of pocket. So when they go to use those services, they're going to pay their out-of-pocket portion until they reach that deductible.
Okay.
Which usually will happen in just a few visits or a couple of services, and the deductible is met. For some people, it may just be one service. So,
because you were mentioning like some people don't want to use their Social Security for their like, what did you mean by that?
Okay, so those are, we're talking people living in the community at that point. There's when you live in the community, your Medicare costs comes right out of the Social Security off the top before that person receives their
Social Security.
Gotcha.
But when they go into a skilled nursing setting, then they have to pay their Social Security. It's called a patient monthly liability or a PML. And so that monthly liability goes to the facility, because wherever your care needs are being met, that's where your money has to go. And so that's the concept. So a lot of times this takes family members by surprise. They move in together to conserve costs, maybe to help budget, and just to have better quality of living. And so they move in with mom, or mom moves in with them, and then they're used to that Social Security, and that becomes a part of their monthly budget.
Yeah.
And then if mom has to go into a nursing home, then they typically say, but I need that Social Security. That's covering part of the mortgage, you know. And that you can't have the best of both worlds. Medicaid will not pay for your housing in two places. A lot of people want to keep their home. Well, I'm giving my home to my children. There's nothing like leaving a legacy behind. And for a lot of minorities, they've never been able to do this until recently. And so they don't want to give up that home. They want to leave that to their children or grandchildren. And when they think of having to go into a nursing home, that's often
the trade-off.
Yeah, that's often the trade-off. Exactly. So to get back to what you said about, look, I'm Debbie Downer here. She's yes.
Angry, but
Yes. Yeah. And so to get back to your question about where that comes from. So the FICA is the Medicare. And then Medicaid, it used to be about 50-50 funded by the state and by the federal government. But recently there's been a shift where the federal government is actually paying more. So now they're paying about 36%, and then the states are paying about 36%, and the federal government is paying the rest.
for the Medicaid.
For the Medicaid. And so Medicaid is for anyone at any age. Now, you sometimes hear of younger people having Medicare, and you wonder, hey, they're not 65.
Right.
So that has to do with disability or being deemed officially disabled.
Okay.
And so if a person is younger than 65, but they are on dialysis or they have certain medical conditions that render them completely unable to work and earn money, once they've been disabled for 2 years, 24 months exactly, on month 24 or that day after, then they qualify for Medicare.
Okay.
And so these people can then enroll in Medicare even though they're not 65.
Got you. Now, one thing I thought of to kind of, I'm always trying to think of a way around. If I guess my thought is if you already kind of know, and I guess you trust your family and you're having to deplete assets, couldn't you, I guess, like go ahead and deed it to them?
Yes. So there are a few ways to do that. And I'm not a financial advisor by any means. So I would tell you to consult with an expert. But yeah, you're on the right track.
Or Wood and Bowers estate planning.
There you go. Wood and Bowers. Contact Wood and Bowers estate planning for sure. But Medicaid does a 5-year look back. I've heard that's going to change to 7, but I've been hearing that for quite a while.
Already catching on.
Yeah, they do a 5-year look back. So you're right. You have to plan ahead. You can't wait until you start getting your health starts failing. And to do things like that. But if you wanted to, yes, if there was someone you trusted, you can set up a trust account. And a trust account is probably the better way to go because it is like a will, but it's a will with rules.
Right.
So the person can't access the trust until certain parameters or guidelines are met.
Right.
So a trust account would be a great way. There's also deeds. I just recently started hearing about a ladybird deed. I looked it up. I'm still not really clear on it. But I had a patient's daughter say that to us during a care plan. Medicaid can't take my mom's house. She ladybird deeded it to me. And so I'm still not real clear on that. Do your research on a ladybird deed. But I know a deed and a trust, those are two ways that people can maybe protect some of their assets that and do it legally, you know. But planning ahead is the key to that. Absolutely.
And that's what you was talking about, like planning for, elderly care, where if you're blessed, you're going to get old and you're more than likely going to have ailments, and you may or may not, need it to the point of assisted living.
Right.
But everyone should plan for it, right? I mean, just do. We talk about it all the time. Just do. And that, it's the responsible thing to do. Not like you said, not only for generational wealth, but for that's protection for yourself.
Absolutely.
Because like you said, you don't want to be in the position where you've gotten hurt and you have no other options and you're getting kicked out of a physical therapist place because your Medicare's run out, and there are ways to plan around that.
And even while you're because things happen when you're not old, right? So like I know it's a couple dollars a month through your employer to get that long term, and it covers up to, I think the highest I've seen is like 65% of your whatever you earn now. So if you're going to be down and out for a while, at least okay, I'm getting some income. So even if you're not 65, like be thinking about that when you go to enroll and you do your benefits, because it's a couple dollars. Like I said, I don't think it's any more than $5 off your check to know that if something happened to me, like I'm okay.
Right. Short-term disability, long-term disability, and then some of those other plans like AFLAC type of plans, or our company has Unum. It's the same concept as AFLAC. So just something that will provide additional support, additional funds if you're unable to work.
Yep.
And of course, I can't emphasize enough having an emergency fund. They used to say 3 months. Now it's up to 8.
Yeah. 3 months is just not enough.
Yeah,
Not
that
these
goes
days.
real fast,
Yeah,
doesn't it?
does.
Yeah.
And so with the you were saying, I forgot what I was about to ask you. I know you were talking about the emergency funding, but you had said something right before that made me was like,
Unum,
I can't think of
Aflac.
what is, how do you spell Unum anyway?
UNUM.
UNUM.
Right.
Oh, so that's what I was going to ask when you were talking about that. So you said if you have supplemental insurance, those short term, long term, you can still use Medicare, or will Medicare say, oh, well, you have other options? So, like, how does that work?
Yes, that's a good question. So, some people have insurance through their employer, and then they either turn 65 or they become disabled, unable to work, and they qualify for Medicare. You can keep multiple policies, but the Medicare will trump. The Medicare will trump. So, and then that other policy would become your supplemental insurance. So you can definitely keep as many insurances as you want. You just want to make sure that you're not, I don't want to say overinsured because it sounds like, well, how could you be? But you don't want to be paying for a policy that's doing something that another policy is also doing. But having a insurance policy and using that for your eye exam, your dental, your hearing, that would be beneficial once you know that Medicare doesn't cover those costs.
Yeah.
Right.
Yeah.
And then also, I mean, if your job offers it, kind of also, not that it's for everybody, because I mean, recently I had a friend went to the hospital and had an astronomical bill. Thankfully, they had great insurance. I went to for a day and had an astronomical bill. You know, I'm not going to talk about our insurance, but it is what it is.
Right.
But to that point, you know, making sure that you have those insurance plans, and like you were saying, you know, you don't have to be old to have to need it. But in those insurance plans, I will also look into maybe look at HSAs. As well, because that's something else that you could use for a retirement. Like the FSA, it ends every year, right? But the HSA carries along with you, so it's also like another insurance plan,
Right.
And again, I was saying that my point of saying that is like it might not necessarily work if you have maybe diabetes or high blood pressure or something where you know you're constantly having to go to the doctor because you're going to be out of money. But if you're relatively healthy, and you don't have a lot of different prescriptions, you're not going to need that money. That's money you could be setting aside like a savings account. It's a health savings account. You have to have a high deductible insurance plan in order to have an HSA, but that's money you could be saving, and it's just another retirement vehicle, really.
Right.
It's true.
Yeah, that's a good point you made too. Chronic conditions. If you have chronic conditions, you want to make sure you have adequate coverage for sure.
Yeah.
But a lot of people say, well, you know, I'm healthy, I eat right, I exercise, I minimize the stress levels, but anything could happen at any time that, you know, a car accident, you know, anything. So even if we take responsibility to make sure that our health is adequate, things can still happen.
Life, as we say.
Yes, absolutely.
So, did you have any other questions?
I don't. I have thoroughly covered.
Right, we're covered. Yeah, it was,
and
really,
down in the dumps now. Yeah,
I mean, it's just sad talking about elder care anyway. I just feel like
right.
You gotta be strategic. It's just
you
what
do.
you know. Like, okay,
Right.
you do,
But most people don't know what they don't know.
yeah,
exactly. And you pay for what you don't know.
pay for what you don't know. And that's why
Right.
we are here as Divas and Ducats to try to provide y'all with as much information and bring on these SMEs. But you know, we can lead you to the water.
Lead a horse to water.
Can't make you drink.
Right.
So
Exactly.
you have the information, and definitely, you know, definitely do research if you do have those Medicare plans. If you have an Advantage plan, to kind of understand what's in that plan, because oftentimes we don't like reading the small print, and you know, we sign
the devil's
things.
in the details.
It is,
So,
and we sign
read
things
it.
and just hear that phone conversation, but don't know what they've sold us. So just be really informative about what you have.
Yeah.
Absolutely.
Well, we thank you for Ms. Butler for coming on,
Yes,
Melinda, for coming on. I really, really appreciate your time and your information.
Thank you, ladies. Thank you for having me. I had fun.
Yes. So again, if you are watching us on YouTube and you have not hit that button below, you made it all the way to the end of this episode, go ahead and subscribe, because obviously you like what you're seeing, right? You done made it this far. So go ahead and subscribe so you'll be notified of our next episode. If you are on Facebook or Instagram, make sure that you are following us on Divas and Ducats. On both, we are under the same name. You can also go to our website and submit for a newsletter. Give us your information and you'll get those episodes out. And
you can also email us questions, comments, concerns, shenanigans, divaadvice@gmail.com. That is DIVAADVICE. And by the time this episode comes out, we're going to have TikTok. We're going to figure it out. So we'll probably be Divas and Ducats under that as well. So just know that.
We're not, as one of our prior guests said, we are not going to be
twerking on TikTok.
Well, no promises.
Okay. I can't speak for quick, but...
Well, in the meantime, in between time, Divas, have a great attitude, and we will see you next time.
Bye.